session of our valedictory session, and I like to thank our the Chief Director, Dr. Navedita Gupta, for joining us for valedictory session. And apart from that, all my colleagues who are coordinator of this seminar, Dr. Nagarajan, Professor James, Dr. Manoj Alagarajan, Dr. Priti, Rashmi, Dr. Manas, everybody who has worked hard to do this work. And all my student, volunteers who have played very role. Truly, this seminar was international. Why I am saying this truly international? Because we have participation for plenary session from international researchers, people who are working in different research organizations, working in different universities, and NGOs, international organizations. They have joined in this seminar. They have shared their research. Apart from that, we have learned in this 3-day seminars about how people have used artificial intelligence to analyze COVID-related issues. And it was quite interesting to see how engineers, IT person had come into the picture to talk about COVID patterns, models, projections, and all those things. Apart from that, we have also seen during this seminar that people are using different mode of data collection. It is difficult to collect data by face-to-face, but people have changed it, and now they are shifting it to different mode of collection. Maybe it is website, Facebook information, other information, or mobile information to get the data about what is happening in the life of the people. And apart from that, we have also learned during these presentations about the impact on the life of the people. And during our technical sessions, we were having papers on aging and how aged had felt about this lockdown and all other things, as well as we also had review paper on adolescent, how was the adolescent life and how they have cope up with those things from the review. So it was overall, we have a lot of information on the COVID-related issues. Apart from that, we also had interaction because this platform has given us so much that we can interact and with international, our researchers, our friends, our colleagues, those who had worked long back. For example, Somi and I have worked maybe 20, 30 years back, but we are still see each other and we can talk about our research work. And I'm sure this discussion which we had during last 3 days will help our students to develop new idea of research. Because basically at IIPS, we have many PhD students who want to do research, so they must be getting a lot of ideas, what issues are important, how they should carry out the research. Apart from that, this findings of this 3 days seminar will also help planners, policymakers, programmers, because we have seen very good participation from Ministry of Health and Family Welfare. We have also seen good participation from other ministry and organizations. I feel these findings and these discussions will be useful. For example, census people have collaborated with us and we have discussed about the estimates, what we will do for the future estimates of census. So a lot of things have come out from this seminar, so it will be useful for the people to use this information for planning and policy making. And at the end, I am so happy to see that virtual world is also possible in this situation, and we can have conferences, symposiums, workshops through this media. Thank you very much.
Thank you. Thank you. Let us move on to just a small summary of what has happened last 3 days, because it was a 3-day international seminar. There were several plenary sessions. There were several technical sessions. So Professor Nagarajan will give a brief idea about what happened last 3 days. Over to you, Professor Nagarajan.
Yeah, so good evening to all of you. So a brief summary of the sessions I will give you. So we organized this seminar with an objective, during the planning stage for the conference, we sat together and made an objectives, different objectives for this seminar. So mainly we have identified the themes, and the themes are mainly on impact of pandemic on various aspects of our lives. Of course, pandemic affected everyone's life. We all are affected directly and indirectly as well. And so to know the impact, we identified the themes. So utilization of healthcare services by various sections of the population, and also utilization of maternal and child healthcare services, which are dear to demographers. And WHO has identified that COVID has impacted maternal and child health services greatly in less developed countries. So we identified that theme, and also delivery of healthcare services also got affected due to pandemic. So we kept that as a theme for the seminar. And also marriage, fertility, family planning, and abortion services got affected. And morbidity and mortality also is an issue during the pandemic and after the pandemic as well. And psychosocial and economic effect of population was a theme. And migration and remittances, social policies, how social policies were delivered, and how government various governments have brought in social policies to address the pandemic to help the poor people. And also the gender issues, which was highlighted in the media a lot. So gender issues, which was just concluded a session, the last technical session of today was on gender issues. And also, the estimation of pandemic, because there are a lot, for the government to act on the policies, you need to have a number. A number with good quality is necessary. So we kept a session on estimations, projections, and also spatial pattern of pandemic. So this was the set agenda, and we made the brochure and circulated. And we received papers on all these aspects. And the session was, the conference was inaugurated on 18th March. And Professor James, our director, gave a welcome address. And the seminar was inaugurated by Mrs. Sandhya Krishnamurthy, our new Director General in the ministry. And Professor Syed Dunisa briefed about the seminar, the structure of the seminar. Yeah. Next. And these are the, in addition to the technical sessions, we also made 6 plenary sessions. And the 6 plenary sessions mostly on pandemic, but there are 2 sessions, one on NFHS 5 and longitudinal aging study in India, which was recently completed by IAPS. So we kept 2 sessions for that. Remaining sessions were on pandemics. The estimation on projection and pandemic, and of course, our census got affected. 2021 census result, by now we would have got it. But we could not get the census because census could not be conducted. A session on census was arranged. And also the psychosocioeconomic impact of COVID, which was the just session concluded just now. So these are the 6 plenary sessions. There was a chairperson, discussant, and 4 or 5 panelists, and the rapporteur was there. And out of these, in 3 sessions, we invited papers. 3 sessions were panel discussions. So that's how it was, we conducted the plenary sessions. And then, yeah, next one. Okay, I think we can skip these. So these plenary sessions, and either presenters or panelists are there for all the 6 plenary sessions. I will move the next 5, 6 slides.
Ask them to move. Tell them.
Yeah, go ahead.
Yeah. Please move forward. Next. 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 Next.
Yes, yeah. So these are the technical sessions. Each day we had parallel sessions, 2 technical sessions, parallel sessions. So 3 sessions we had. On the first day, we started with the estimation and modeling of COVID-19 pandemic. And then healthcare utilization, that had two sessions, healthcare utilization 1 and 2, because we received a large number of papers. And social policies during pandemic, that was another session, and data collection during pandemic, because people have utilized very innovative methods of collecting data in a challenging situation. So there was a session on that. And also a study conducted jointly by IIPS and the population research centers on utilization of RCH services during pandemic. That study has brought out a lot of, demand and supply related issues. Yeah, but we can next. Next, yeah. And the second day, we had, 3 parallel sessions, morning and afternoon, and spatial pattern on pandemic and impact of COVID on lives of people. 2 sessions we organized because there are many papers. The lives of, all types of, people, common people's lives. Mortality and morbidity during pandemic and non-pandemic period was another session. And migration and pandemic and nutritional status of children. This is a study undertaken by Professor Saidulisa and team with the support of UNICEF. So the papers from that project was presented in that session. Yeah. And on day 3, we had aging, health, and living arrangement. And these are on the third day we scheduled the papers which are not related to pandemic. So general themes from the demography fraternity. That's on reproductive and child health, population characteristics and its components, non-communicable diseases, health and nutrition. These were the topics which were not related to pandemic. But the last session, gender issues during pandemic. So there is a specific session on that. So, yeah. So this is a small numbers. You can see the number of participants in the plenary sessions. There were many participants. Like a normal conference, physical conference. Inaugural session was attended by around 150 participants, and also session on a plenary session on NFHS also attracted a large number of participants. Similarly, the discussion on census estimates for 2021 census, a large number of participants were there. There remain around other sessions, 50 to 60 participants were there in the plenary discussion. And then we can go next. Yeah. Next. Yeah. So these are, if you see the participants in the sessions, each sessions, you can see around somewhere around 20 to 25 participants in each session on an average, you can see. And there are 3 parallel, these are all 3 parallel sessions. If you count the numbers for 3 parallel sessions, it goes around 75 to 80 participants in each technical session. And the number of papers at the next, can we go for next? Yeah, so we received large number of papers, but we had to select because we have to conduct the sessions with 4 to 5 papers only. So we selected only 94 papers for the presentation. Plus we invited 14 papers, not 10, 14 papers, NFHS, LASI, and also the today's last session on psychosocial impact of pandemic. So there are 14 papers were invited. In total, there were 188 papers were presented. And out of that, only few papers were not presented by the participants. Only 6 papers, I think, in all together. So 104 papers were presented in all during the last 3 days. So this is the brief summary of the sessions. Yeah, thank you. Yeah.
Thank you. Thank you, Professor Nagarajan, for providing us the complete idea about what was really happening last 3 days of the seminar. Thank you so much. It's my great pleasure now to invite Nivedita Gupta, who is the Chief Director, the Ministry of Health and Family Welfare. Nivedita Gupta is from the Indian Statistical Service, has been working with the Statistical Service of India, both NSSO and CSO for a long period, and currently is posted at the Ministry of Health, looking after the survey, National Family Health Survey, and similar data sets. So thank you, Nivedita Gupta, for joining us. I know it is an odd hour to join, but thank you for being part of it. And we would like to hear from you about sort of a, not, I don't say it's a valedictory address, but would like to hear from you about your ideas about the seminar as well as the themes, and also on generally on the health aspects in the country. Over to you, Dr. Nivedita.
Thank you, Professor James. Good evening to all the discussants, participants, and everybody around. On behalf of Ministry of Health and Family Welfare, I feel extremely happy to be a part of this international seminar on this COVID pandemic and the various aspects of this thing, the COVID on our different data sets. I have also attended most of the plenary sessions, and it really gave me a deep insight into that how all these studies, papers presented, they very brilliantly captured the effect of the pandemic in our lives. They have analyzed some of the data sets from some recently made surveys. So post-COVID, COVID-19 has invaded not only our health, but also all spheres of our life. So it has changed our way we used to analyze our past data sets. It changed the way we try to assess the present, and it also changed the way we want to plan for the future. So in this regard, I feel this seminar has done a lot of justice to the purpose to which it was thought of. Now, when we are in India, we are almost completing a year of our serious disruption of life by COVID. It is all the more timely and pertinent to look at analysis of data from say NFH's 5 phase 1 states or LASI or CNNS, and to find out how what are the different intricacies. And in today's light, some of the data sets have got different implication altogether. Then during the pandemic, we have seen how different newer methodologies of data collection, especially through AI, machine learning, etc., have developed so that we can get a quick assessment of the present and to find a quicker solution to address this unprecedented, totally unknown situation which we suddenly faced. And to effectively and efficiently address this, we needed to have data as data collection method as a totally different way. And we are very thankful that we could come up with the challenge to evolve the newer ways. The entire public health system, that also had to overnight accept the challenge and refurbish its all aspects to address the crisis. Now, so many interesting insights into the different socioeconomic aspects, different psychological aspects, different impact of this pandemic has been reflected through many observations and many I would like the major observations and major recommendations from this analysis, these papers, be documented, which can help the policy planners and program implementers to bring out an action plan suitably incorporating the recommendations that have been included in these studies. I think this is all from my side. I just wanted to hear more and say less on this occasion. Thank you all.
Thank you so much. I think that is ultimately the purpose of the seminars. We need to really get more insights from such purpose, and then really it should help the country, particularly the policy and planners of this country. Thank you so much for all your insights. I think, let me just, it is the next program just before the vote of thanks, which is the formal vote of thanks, which will end the program. So I have been asked to speak on really the way forward. I think way forward perhaps has been already mentioned by Nivedita Gupta. I think that is the way forward. Ultimately, I think the purpose of such seminars, as I told you in the beginning itself, the inaugural session of the seminar itself, I told the purpose is really twin objectives. Firstly, we also need to encourage young researchers, also a pool of demographic research in this country. That is very, very important, because capacity building, young researchers, finding out the method of analysis, the method of research, helping them how to really do rigorous analysis, etc., is definitely undoubtedly the purpose of such a seminars. I think that is why most of the technical sessions, there has been large number of students who are presenting papers, and they were discussing, who were helping them really to tell them how do we do effectively better way of looking at data, better way of deriving insights from such papers is also very, very important. But that's only one part of the story. The more importantly, what we aim at through this point, because this has been a very peculiar kind of a period which we were going through, and it was unprecedented. We never expected, and we were unprepared. But as a country, as a nation, I think we have been quite successful. I think all over the world now, India has been rated as the country which has been able to successfully take care of the pandemic situation. Although I think there have been different papers which also come out with, I think there are issues which we need to address in a much better way as well. So this is a time, perhaps, 1 year is over. So the 1 year is, as Nivedita has pointed out, is a critical time where we need to have a relook at it. What we have achieved quite a lot, and what we can achieve much better in the future. I think all these papers perhaps has been giving a direction to that level, whether it is a census or whether it is has been estimation and projection, whether it is on the psychological impact, whether it is on gender issues. It all has been telling one or other story. One is, I think, critically important for the demographers. One, especially, all of the papers has been emphasizing what is the role of data, what's the role of analysis, what is the role of estimation. That is very, very critical, because any policies, if it is not evidence-based, once it becomes intuitive, it becomes, I think, it is everyone's choice. If it's become evidence-based, naturally, you are going much more scientifically than more of an intuitive way. So that is the purpose of a demographic community. The community which we are together is a community where we develop data, we make sure that we develop quality data, we make sure that we do the best analysis, we make sure that we interpret and we conclude the data sets, the conclusions are derived so that, we will be able to help the policies and planners. So I think that undoubtedly the biggest part of this seminar. I'm sure the insights which we derived from the different papers, also the conclusions derived from different studies, will be brought together and also will be submitted to the Ministry of Health so that it will be helpful for the ministry as well as for the various state government. That is going to be the major mandate of this IAPS seminar. So let me would like to thank you finally for everyone. I think although vote of thanks is going to come, but at this same time, it's my great pleasure to thank particularly my colleagues who has worked day and night Professor Sedu Nisa, Professor Nagarajan, Dr. Manoj Alagarajan, and Dr. Reshmi, and Dr. Preeti Dhillon, and also Manas, who is there, although he is affected by COVID in between, but he has been completely active, even within the period of COVID, he has been actively involved in transforming information to us, and also about what are the papers selected, all those things he has been handling. Thank you all of you for your wonderful way you organized it. That was completely a teamwork. I was really happy that the teamwork always give dividends. This is a clear evidence of a really good teamwork. I congratulate all of them who was really working at this time, at this hour of the weekends. So also all the participants and all of you for joining. And I would perhaps hand it over that part to Dr. Manoj Alagarajan to propose a formal vote of thanks. Over to you, Professor Manoj.
Thank you, sir. Thank you very much, Professor James, Director IAPS. I would like to start saying that on behalf of the seminar organizers, I would like to thank our chief guest for the evening, Madam Navedita Gupta, Chief Director Stats, for taking her precious time and consenting to be chief guest for this evening. Madam, indeed, your support is encouraging, and this would help us to do more from our side. Thank you very much, ma'am. During our initial phase, started with the preparation on the content for the seminar, and then the brochure preparation. The design was prepared by Motilal Mohare. We would like to thank him for his effort in the preparation and designing of the brochure. Simultaneously, we prepared our online content and received abstract according to the need of the hour. That is due to pandemic. The contribution by Ms. Sheetal, senior programmer, and the background support of the development partner is highly appreciated. This also helped in blind reviewing of the abstracts. Thank you once again for them. We would like to thank all those who had submitted an abstract for the IAPS International Seminar 2021. We received a total of 134 abstracts, and as you all know, we could select 86 abstracts through blind review. We would like to express our gratitude to the participants who had put in their efforts and to present their topic, and our appreciation also due for all the guest speakers, chairperson, discussant, and the rapporteurs for the plenary and the technical sessions. Some of them were contacted at the last hour and had readily accepted our invitation. We had a brilliant trio of three, Mr. Avinash, Mr. Chittaranjan, and Mr. Tarang, under the able guidance of Mr. Anjani Kumar Mishra, patiently connecting each one of us to the respective sessions. Their outstanding effort during the 3 days needs huge round of applause and appreciation. We thank the entire team of ICT unit, including Mr. Sunil and Mr. Kalpesh, for their efforts and dedication. You can also send your appreciation because they are still behind doing their work dedicatedly, and you can send your appreciation in the chat box as well. Thank you very much. We had our scholars, Mr. Shreyans, Mr. Labita Das, Mr. Rajan, and Ms. Chanda, helping us in preparation of the program list, abstract book, and the flyers. Our warmest gratitude is for all of them. The most important, I would like to thank our director, Professor K.S. James, for not only constituting the team for IAPS International Seminar, but leading from the front by providing able support in completing all the activities. He had given each one of us the freedom to take initiative and complete our task. I would like to thank Professor K.S. James, Professor Sedu Nisa, Professor R. Nagarajan, Dr. Manas Ranjan Pradhan, Dr. Reshmi, and Dr. Preeti Dhillon for dedicating their time and energy from the initiation to the end of the seminar. We would like to thank the administration, Dr. M.K. Kulkarni, Registrar, Manjali, the Assistant Registrar, Aniket, Assistant Finance Officer, and all the staff members for their able support in conducting the seminar. I would like to thank all of them once again. I would like to thank all of you present for this seminar. Thank you, and thank you once again. Thank you very much.
Okay, thank you, Dr. Manoj. And that comes to the close of the 3-day international seminar. Thank you once again, all of you participating. and have a great evening or good night ahead. And we will see you sometime whenever IAPS holds such program. We would like your kind cooperation in the future as well. Thank you, and we will close this session.
Thank you.
Thank you so much.
Thank you very much. Thank you very much.
Okay. I enjoyed working.
Yes, yes.